Very good evening to all the viewers, all the participants who have joined us today for this webinar. This is Dr. Neha from Team RadarOpus from Vision Group of Companies, and I'll give you demonstration on this. And today we are hosting a webinar for you on the topic dermatological conditions and how they're managed with homeopathy. So today we have Dr. Sadaf with us, who would be giving her insights on this webinar. So before getting into the session, before starting the session, I would like to give a brief introduction of Dr. Sadaf. Dr. Sadaf have completed her graduation in year 2009, and since then she is in homeopathic practice. She have undergone extensive training under many national and international homeopaths, well-renowned homeopaths and doctors. She have done her post-graduation in clinical research in psychology. So she have been working in field of psychology and promoting lifestyle enhancement workshops as well. She is associated with many NGOs as well, where she provide her services. She have been awarded by Bharat Times as well as a healer of the young generation 2015. So it is a great pleasure of ours, Dr. Sadaf, to have you us on the RadarOpus platform today. So before much ado, we will straight away jump to the topic. So
Yes.
platform is all yours, Dr. Sadaf.
Thank you, Dr. Neha. Thank you for inviting me. So, homeopathy and dermatology is the topic that has been given to me to share and to see how we can make use of homeopathy in itself, how we can analyze the case, how we can progress in our dermatological cases, especially with the help of different softwares. So, like we know that in homeopathy, we do not have just one system and one way of prescription. Okay, unlike other sciences, like in allopathy, it's very simple that if anybody is having a headache, you give XYZ remedy. If anybody is having a particular condition, there is a given protocol, and all the doctors will work according to the protocol. But in homeopathy, it is a little different, and more confusions and more complications are there, and confusions are there between the students because we have variety of approaches. Okay, and every day our list of medicines is getting upgraded. Every day we have some very varied range of medicines, varied range of system of understanding. For the students at time it becomes confusing as to what shall we do in our practice. So like in most of my lectures and with most of my interaction with students, I say it's always that first and foremost, keep it simple. Your cases, let your patient help you decide what is the approach you will take, what is the style of case taking you do, and there is no shortcut. So today, if you're asking me in dermatological cases, are there some specific remedies that you are going to use? For example, if my patient is having acne, do I give a XYZ remedy and he's going to be okay? Or my patient is having psoriasis, ringworm, is there a specific protocol? Then this lecture, if you're asking for shortcut protocols, then this lecture is not for you. This lecture is to understand how you can make use of homeopathic case taking, analysis, repertorization, and give an individualistic treatment, irrespective of the remedy. The remedy can be simplest. I remember a very early case in my practice that I treated with a simplest of remedy like calendula. Okay, so there's no harm in using simplest of remedy, but your approach, your understanding of the case should be fixed. First and foremost, never forget the laws of individualization. I'm not sure about what is the range of participants. There could be newbies, there could be somebody who's an expert. I will try to maintain a balance in my um, participation. Dr. Neha, if you can just give in this, that are we having interns, are we having practitioners?
Dr. Sadaf, I got cut off due to some internet issue at my
No
place.
problem.
So you can continue with that.
No
So,
issues, no issues. So
yeah.
just, Dr. Neha, I was asking you that is there a specific crowd that we have, like it's only new students,
It is mixed
interns?
crowd. It is
It's a
mixed
mixed
crowd.
crowd.
It
Okay.
is being, it is,
So for seniors, if it becomes too simple, please don't mind. And for juniors, if it is becoming complicated, do not panic or do not be worried that, oh my God, what is this? Are we going to get, how are we going to go about in our practice? So I've kept very simple cases for today, and I will try and simplify my explanation so that even a student can understand and even a practitioner can understand. Okay. So without much ado, so in dermatological cases, what is the specific thing or what is different that you're going to do? So there are certain pointers that I keep in mind when I am dealing with certain set of cases. Okay. So for example, if it's a psychiatric case, my approach will be a little bit different. My protocols as in not the name of the remedies, but how I will follow up with the patient might be different. If I am dealing with a deeper pathological cases, the approach will be different. In dermatological cases, there are two three things I keep in mind. Okay, number one is we know that a lot of disease occur due to suppression. There is a lot of disease which comes up due to just a little bit exacerbation of sora. There are a lot of disease which could be relapsing, like tubercular. Okay. Especially in present condition, like many of the disease condition today, we see a lot of tubercular cases getting intermingled with skin complaints. So I keep an approach. First of all, I see, number one, is this case an acute or is it a chronic? Okay, if it's an acute, if the patient is very new to me, okay, I will take it as a new case, plain sheet. Okay, but if a patient is under my treatment and then an acute comes up, my next line of thought will be, what could be the remedy reaction of the previous remedy that this particular symptom has come up? Okay, this goes with all your cases. Okay, even if you're dealing with asthma, even if you're dealing with rheumatism, you will have to see whether it's an acute, whether it's chronic, whether it's acute on chronic case that you're dealing with. Nowadays, especially with online case takings, many a times you just get a random person calling you and booking an online appointment, and they don't want a chronic treatment, but they want some urgent help, but they want with homeopathy. Do not rush in, or do not panic, or do not turn away the patient. Just take it as the patient is coming. Okay, see, ask the patient in your detailed history, is it a chronic complaint, has it come up all of a sudden, or is it something that he's already suffering and it is a remedy reaction? So in different cases, different scenario, the approach in itself changes. Okay, so for example, I'm treating a case of asthma, okay, or rheumatism, and suddenly, so let me give a better example through the patient that I have seen. Very recently, I was treating a patient with goutic nodosities. Okay, so when I was treating with the gout complaints, patient was doing better with the physical complaint, but suddenly a lot of skin eruption started coming up. Okay, and then the patient called up with a panic saying that I'm having an eczematous reaction, what do I do? Okay, so number one, I said, you book a proper timing, book an appointment. It cannot be on phone. Either you come in person or a video call. In person in dermatological cases is better because you get the exact feel, whether it is an eczema, whether it is dermatitis, whether it's ringworm. You won't understand merely with picture or with videos. Okay, so sometimes in skin cases, in person interaction is way better than an online interaction. They won't be my these cases won't be my preference to see online. Okay, so when the patient came in, I took an advantage of that situation and I asked him, was this any time in your life you had suffered from similar condition? And at that point, he denied, but when I kept on changing my question and again sticking to the same point, he came to a point where he remembered that as a child he had several skin related issues. What he doesn't remember, it was treated with different kind of remedy, it was gone. And then a year before he actually got gout, he had a big huge bout of eczema for which he had taken steroids and it had completely gone. And then the then the gout started. Now when the gout has come back, it's not that you have to leave it untreated. Okay, so now when the gout has been better and the eczema is back, I will try to understand what is the totality over here. Okay, are we, how is this in the intensity compared to before? Is it bearable, is it unbearable? And then depending upon the symptomatology, you give a remedy. Okay, in that particular patient I had given graphitis and patient was doing well. Okay, and then the slowly steadily the eczema also got better, and then we knew the case was back in the normal track. But before you intervene with any other remedy, you will have to see if there is a clear totality. If you don't see a clear totality and patient is not sure about it, most of the time I leave it untreated. Like you just give placebo or you give some tissue salt remedy so that the patient is relieved, but no major intervention with the uh, constitutional medicine is being done. Okay, so you will have to gaze through how the patient is operating at that moment. But if it is an acute or it has come as a standalone case, like the case that I'm going to present right now. Okay, so this, for this case, is a case of this patient came, it was a child, say 8 to 9 years old, female. She came with a lot of whitish discoloration on the face. Okay, the dermatologist and even I, when I saw the patient, because it was not a vitiligo, but there were white skin discoloration with slight dryness of the skin all over, and these white discolorations were a little itchy in nature. So we thought it is a tinea vesicular eruption. Okay, I'll show you the picture. You can see this part. Similarly, on the forehead, both the side of the cheeks, there's white discoloration. Similar discoloration was there most of the part of her face, not on the part which are exposed to the sun, or sorry, not to those part which are covered. It was all only on the face and neck area. This discoloration was there. So the mat had given her some antifungal creams, etc., etc., but it was not respond, the child was not responding. In fact, the eruption was getting bigger and bigger. You could see this is the whole cheek of the child that was affected. Okay, now when I saw the patient, mother said, can you give something? I said yes, but we need to speak to the child, and we started the history. This is a case of a villager. Okay, so the history taking, so I had to decide what will be my approach. So when the child came in, the first observation that I saw about this child, she was very thin. Even you can see in the photo, she had this long, typical long neck, and she was extremely shy to open up. Okay, so still I managed. So I kept mother, I saw that when I normally I keep patient inside my cabin. Okay, and I ask the parent or the attendant to go out. But in this case, the child was extremely wanting the mother to be there. She couldn't function without the mother. So I asked her, stay back, don't go. And when we did that, she said okay, and she started speaking, and I'm just giving you a brief history of it. Okay, she says that the skin eruption was since January. There was a big patch on her face, and this there was a lot of skin. Like I said, they had been to skin doctor, dermatologist, and they had taken a lot of treatment. There was aggravation that will come up when she was exposed to sun heat, dust. Okay, by as a child, she always had recurrent sneezing. Okay, she had dust allergies. She was intolerant to any kind of a strong smell. Okay, mother says that anything can affect her, and she easily falls prey of a lot of allergic reactions. Okay, uh, by default this child will not like, mother said कि इसको अगर दिन भर आप खाना खाने को नहीं देंगे ना, ये बहुत खुश रहेगी. इसको जहां आपने खाना खाने को बोला या खाने की बात करे, वहां इसके मुंह टेढ़े हो गए, सर दुखेगा, पेट दुखेगा. In short, are we having some international crowd also, Neha?
There are usually people who join us from Philippines
Okay,
and other
so
countries.
those who do not understand Hindi, so for them I'll translate. So the mother said that, mostly this child is will be happy if she's not given food the whole day. Okay, if you moment you ask her to eat or you force feed her, she will have some or the other symptoms. Okay, so I asked the child, you tell me what is happening. So she described that there is a lot of itching. Okay, itching is there all over her body. Okay, and there is she cannot see any blood coming out or any freckles coming out or any vesicular eruptions coming out, but there is a lot of itching that she says there is a lot of body ache. She also spoke about but she will answer little and then she will keep quiet. And just to warm her up, I just asked, what do you like? What do you really like in food? What do you like to drink? Tell me about you. So I was trying to build up the rapport with this kid. And to tell you, it was a little difficult to build up a rapport with this child. So she says, I like sandwiches, I like pizza, I like burger, I like bread, butter, bread, jam. So with that, you get an idea that there was a lot of bread consumption, and mother interrupted and said, yes, she is a bread lover. Like, in every meal, if you give her उसको अगर आप पाव सालन दे दो या पाव भाजी पाव और सब्जी दे दो, वो खा लेगी, बट रोटी चावल नहीं खाती वो जल्दी से. उसको सब चीज ऐसे स्पाइसी चाहिए रहता है, बर्गर वगैरह चाहिए, अच्छा बोलते ना वो ऐसे चटपटे चीजें चाहिए होती है. सो फॉर नॉन हिंदी स्पीकिंग पार्टिसिपेंट, मदर सेड शी लाइक्स एवरी आइटम मेड इन ब्रेड. शी लाइक्स ऑल she likes all items which are not basic Indian food or the basic native food like dal, rice. She will not like that. She will want non-contemporary food like burger, pizzas, chips, fried items, spicy items. That's what she enjoys. Then her skin, mother said, was a little sensitive, and most of her complaints, like even if she got hurt or if she's banged herself, immediately the skin will show some or the other reaction. There was hair falling, there was dandruff. So basically, if I could just understand, if I have to give a remedy to this child, I need to give a remedy that has a predominant action on skin. Okay, that was the basic, basic conclusion that I could derive after interacting with both mother and the daughter. Okay, so I will go ahead. So this was the basic uh, chief complaint that we could understand, the basic uh, concept or basic conclusion. So here I will also like to highlight on the part which says what I do in my case. Okay, so when I start, okay, with the case, I try to understand where there is something called as a lot of energy, or what Dr. Shankaran will say as a hot spot, or where I could anchor my case. Okay, so I'll scan through my case, whether it's a form that they fill in and they bring, or whether it's a history given, and some initial 10-15 minutes of my consultation I will use to observe. Okay, so I will observe both patient, the attendant, the dynamics between them, so that now why do I do it? Is it that in 10 to 15 minutes of my consultation I decide upon the remedy and then just confirm the remedy? No, the initial 10 to 15 minutes what I have seen is the most important, because it helps us to understand where the patient will take you. Okay, and what approach the case will be needed. Okay, um, so okay, just before I go ahead, Dr. Neha, when I start talking, I may lose the track of time. So give, if at all I'm crossing my time, please let me know. Okay, let me know
Sure.
10 minutes before so that I can wrap up very nicely. Otherwise I'll just go with the flow of the case and rest of your presentation will also get affected. So coming back to the topic, so when I'm sitting with the case in first 10-15 minutes, I will think and I'll ask myself, what do I need to do in this case? How do I approach this case? Okay, what is it that will help me to reach to the right remedy? Okay, so at this point, my thinking I'm sharing with you is my thinking. I'm not talking about the medicine. The worst thing, I'm sure a lot of medicine, when you hear dust allergy, sun aggravates, bread consumption, a lot of remedies might coming in your mind. So at this point of my time, whatever remedy comes to my mind, I shun it off. Okay, it's like a stopwatch. No, not remedy. I have to focus on what the child is doing in front of me and then decide upon what approach I will take. Okay, I will understand that what level of experience my patient is. So not because that he's a child or she is living in a native area, or a rural area, she's not speaking. I have cases where rural people have spoken more wonderfully than urban people. Okay, so, and I have cases where urban people, sophisticated people, have not spoken at all compared to somebody staying in the rural area. So it's both the sides, it's person to person, it's not because of the socioeconomic status. Okay, but yes, you do pay attention in the background on socioeconomic status. If a parent of the child, especially if it's a child, if parent of the child is already a patient, it also gives you an idea about the family history, which gives you an idea about what miasm this person could be, or what could be the maintaining cause, what could be the fundamental cause of the disease. So that goes on in your background. Okay, that is what goes in my background. So now when I'm looking at this child, I see somebody who doesn't interact much. She's timid, she's shy, she's not very open, she's reserved. Okay, she's not going to speak up more. So in this case, I will try to gather as much as possible some concrete physical symptoms. Okay, and I base my prescription on these concrete physical symptoms and then see how my mind and body can come to a match. Clear, everyone, till this point? So here my thinking is, what level is this patient of mine? Is she at level 1, level 2, level 3, level 4, 5, 6, 7? That's going on in my background. Now what is level of experience is where in at every stage of your life, we all view our life experiences from a certain base. Either you uh, experience it at level of factual. Okay, so in fact, suppose if your patient has a level fact, okay, he will be good enough to give you physical modalities, physical characteristics, symptoms, physical generals, but may not give a lot of emotional symptoms. Okay, if a patient is at an emotional level, the predominant state that will come in front of you will be a lot of emotions. Okay, if not, you can, if it's a person can, if it's many cases, you'll see they live their delusions, and then you know your approach. When you see a case like that, you change your approach. Okay, in homeopathy, you have different approach. You have keynote approach, you have polypharmacy, you have sensation, you have predictive, you have HHF, you have many approaches. Okay, and every approach is wonderful. I have tried and tested most of the approach, but it is wonderful if the patient and the approach also matches. Like how you need to match the remedy, similarly you also need to match the approach. Not in all cases you can take up the same thing. If there are cases where at this level, patient may not talk only, they may just go up and say how I remember one vitiligo case I had, and the female started with the statement, please can you do something so that I don't see this horrifying face of mine. And she started with a lot of horrified feeling. She's like, I'm tired of being outcast. And then there was a whole theme of being outcast, of being suppressed, of a lot of victimized feeling, and a lot of different how people look at her, how they shun her, and how dirty she feels in her skin, and different different sensations that came up. So that was the case where I didn't even ask about the physical modality, generals, nothing. Okay, now if I have a case like this, I will think and I will try to understand where can I have a concrete holding. And these cases are very easy to solve. Okay, where people are giving you, actually when patients give you a lot of uh, info, those cases can be difficult because you cannot pinpoint on one thing. Okay, there are a lot of things happening, and then more than the patient, the doctor needs to be calm, patient, in a meditative phase to catch out that minutest detail. Clear, everyone? It will be good if just very quickly everybody will put yes or no so that I can take a next step.
Dr. Sadaf, you can continue
Yeah,
because we have only half an hour remaining.
remaining, yes.
Yeah.
So if till this point I am assuming that it is clear, if as we have only half an hour, I will need some 5-10 minutes where I can take Q&A. So I'll move ahead with the case. The next point is, I asked in this case is, what are the past histories? Okay, so mother says she recurrently gets infested with worms, and mother is deworming her very continuously. Okay, she will get fever. Okay, and with every 15 days she will get fever, cold, cough. So recurrent allergies were there. So as we know, she has a history of allergies. So she said till her 5 years of life she was absolutely okay. Okay, but then slowly steadily this fever, cold, everything started, and the worm infestation started, and now this skin complaints have started, where she's become also these allergies issues have come up very frequently for her. Fine, we note it down. Okay, then I tried to ask more physical symptoms, but they were not of great importance, so I've not mentioned. Now comes to a point where I'm asking about her emotion. So when I asked about her emotions to her, she just kept smiling at me. Okay, and she will giggle, or she will smile, and she will just look down, and she will not really speak much. That's the time the mother intervened, and she says, she's not talking right now, maybe she's shy, but she doesn't share. At home she's very talkative, but it's only when I am there, when it's just me and her, she's very talkative. And anything happens throughout the day, when she goes to her school, when she's with her friends, with her cousins, with her aunts, with her uncles, anything happens, every detail she will share with the mom, but she will not share it with anybody else. Outside people will think that she's very calm, and she's not much interactive, but at home she will be super interactive, that too in presence of her mother. So I again tried to build up a little conversation with her, and I tried to ask her if she could say something. She was like, she didn't say anything. I said, बहुत गुस्सा आता है आपको? I asked her, do you really get very angry? So she laughed. Then I said, why do you get angry? So she says, my cousins and all, they just keep making fun, and they don't understand anything, so, and they're kids, so that's why I get angry on them. Fine, that's it. And then there was a big silence. Then I said, I asked her further, can you tell more about yourself? So again she was not very much um, talking about it. Then the mother said that, when she gets angry, mostly she will hit, especially her cousins who are very small, like they're 2, 4 years, 5 years, 6 years, like very small compared to her. So she will hit them, and that is there. So, and then she is very scared of her dad, because her dad is a little short tempered, and he may shout at her. And when he shouts at her, she immediately feels like crying, but she will never cry in front of him, or if there are a lot of family members, she will go in one room and she will cry. Further, when I asked her, what is it that affects you the most? So if you have seen her previous picture, you will see her complexion is dark. Okay, so she's dark in color. So all the time she's been criticized for her color. Okay, so she feels that she's not good enough, she's not good in looks. Then mother said, now ever since she's got this patches, she's even more concerned. She's very concerned about her looks, how she is appearing, because everybody will now, earlier they will question her about her skin color, and now this skin patch that she's having, so that may create problem for her, and that affects her emotionally. And when I spoke about this child quickly turned her face and she was wiping her tears, and she was not ready to like open up. And the moment she was trying to talk, it was with a very heavy heart that she will talk, and I tried to, like, calm her down, console her, which she it could not go well with her. And when I was trying to talk to her, I was trying to, convince her to speak or open up, it didn't went on well with her, and she will just kept quiet. She was holding her emotions. Fine. So I thought I will, this is her sensitivity. So I do not provoke that more. Maybe later when she's more prepared, I can take her to this sensitivity. Then further, I asked her, what does she like? What are her likes, dislike? Is she scared of anything? So I thought that will, kind of burst the bubble and open her up a little bit. So she said, no, I'm not scared of anything. She enjoys studying and she secures good marks in studies. She's very good in all the activities. Mother says, whatever work you give her, she will take care. She's extremely caring. So every time her mother will come for her treatment, she will accompany her mother, and mother will ask her, have you noted down how doctor has asked me to take medicine? And she will exactly note down. I said, why is your daughter noting it down? The mother will say, I may not remember, but my daughter, she's so caring, she takes care of everything, and she know exactly when I need to take medicine and when not. I may forget, but she will never forget. And whatever instruction you give me during our consultation, like your diet instruction, the exercise instruction, she'll make sure that I am doing that. And if I'm not doing, she'll say, I'll go and tell doctor auntie when I meet next. So she's very careful. And it's not just me, anyone in the family who's sick or it's not better, she will take care of them. She's a very silent and calm girl. She'll take care of everyone, very loving. But she will never open up to anyone. She will not make friends easily. She will not talk what's happening to her. Even if she's sick, sometimes mother says, even when she's sick, she will not open her mouth. It's when I go close to her, or if I check her, I will come to know that, okay, she's having fever. Or if she suddenly starts to sneeze or cough, then I will realize that, okay, there's something wrong. But this girl will never open her mouth. Okay. So this was more or less the case. Okay. So before I go ahead, okay, this is more or less the case. Before I go ahead, anyone can, or we just skip to that part and go ahead. Anybody can just very quickly say what is their understanding, put it in a chat box or something, and tell us what is the understanding, or how, what could be the rubrics you all are supposed to take. Okay, so like I'll not waste much time because we have very less time, so I will not wait for people to answer. I'll just go ahead. So this case was very simple for me. So how do I move about? So I have some set of physical symptoms. I have some set of symptoms of a personality type, who she is. Okay. I may not have a very deeper symptoms of her delusions or anything, but I have a basic idea as to who is the person in front of me. Okay. So first and foremost, what I will do is I will pick up all the physical characteristics and I'll put in the repertorization. Okay. Why physical characteristics? Because I believe in such cases, physical characteristics are the symptoms which are very sure. It's like 1 plus 1 is equal to 2. Right? Emotional symptoms can be very subjective. Okay, one will say, oh, she's like this. One will say, oh, there is suppression of emotion. One will start interpreting, and interpretation in homeopathy sometimes I feel kills the case. I like to take up symptoms which I can take as it is and then reconfirm with the mind symptoms. Okay, so in this case I will see what is the main highlight at the physical level which I find is characteristic to this child, and I will put that as it is in the case. Okay, okay, I'll have to start. So what I did was, there were certain physical symptoms which were very character. First was, there was, what did the mother talk about this child? Okay, that if you keep her empty stomach, she's happy. Moment you force feed her, there will be problems. She will have an issue. Okay, so the first rubric that I will consider is fasting ameliorates. Okay, then the desires, food and drink desires. Just 1 minute. Let me see if I can share my repertory with you. Or Dr. Neha, can you share the repertory? Can you share the repertory so we can give them how the repertorial thing can look with radar also?
Yeah.
Yeah. So first and foremost, I will go in generals, food and drink chapter.
I hope my screen is visible.
Yes, yes, your screen is visible.
Yeah, food and drinks.
Bread's desire.
Bread, desire.
Okay.
So should I take it into the repertorization?
Yes, take into repertorization. Then she said she enjoys all junk foods like pizza, burger, chips, biscuits, but not the normal food. So I will take furnishes food desire. Next rubric will be that.
Added that.
Okay. Then you will put fasting. In general, generalities only, fasting ameliorates.
Added that.
Now in radar, if you have Fatak repertory, now I will, so this was synthesis repertory or complete repertory. Now I will check in a smaller repertory because these are very characteristic physical generals. Okay. So in Fatak repertory, I will go and take relapses, recurrence, attacks, recurrent.
I'm taking it in next clipboard, or should I take it in the same clipboard only?
Same clipboard, same clipboard, no problem.
Okay, fine. Yeah, done that.
Okay. Once you have done that, so what are the rubrics that you have taken up till now? I think 4 rubrics we have taken,
4
right?
rubrics I've taken. One is
Fasting, relapses, recurrence. Now these are physical generals in front of us. Okay. Sun aggravates, generality, sun aggravates also you will take.
from Fatak or synthesis.
Take from Fatak also will do.
Sun aggravation. Just a sec.
Go in synthesis otherwise. Chalga. Sun exposure to sun aggravates.
Just a second. Added
Exposure
that.
to sun. Yeah. Okay. So now you go to the repertorial chart. So we have certain rubrics with us, okay? And we have a list of long remedies which normally comes in every. So there are remedies like natrumure, belladonna, natrum carb, pulsatilla, arsenic, calcarea, sulfur, lyco, Trichia vulgaris, Lachesis sorinum, Zincum, Agaricus, Barytica, Baryta iode, Cocculus, Iodum, Macam, Naxomica, Plumbum. Long list. Okay. Now, from this list, I have to pick up the remedy that will personally belong to her. Okay. Now my work is easy because I have some definite symptoms with me. And now what I will start doing is reducing the or eliminating the possibility of other remedies. Okay. So what I see throughout, I have a huge picture of maximum mineral remedies coming up. If you see, you have natrum, natrum carb, aurum, natronatum, zincum, baryta carb, baryta iode. Okay, don't apply filters. Wait, don't apply filter. Okay, so I see there is a huge list of plant remedies, mineral remedies. Then next I have certain plant remedies like pulsatilla, ignatia, lycopodium, agaricus, aloes. There are few. Okay, then I have one or two animal remedies. Okay, I think it's only one. Lecax is the only animal remedy that is there. Carcinosin is a no soul. Okay, so my mind is going, okay, what is the list? Now, my case taking of this particular case is not at that level, okay, where I will have a clear picture of whether this case is a plant, mineral, or animal. When you have to differentiate according to sensation method a particular case into plant, mineral, and animal, the patient has to cross the delusion level and go. This child didn't go there. She was stuck between fact and emotion level. So I will not interpret over here हाँ उसने ऐसा बोला तो वो ये है. No. I just have a certain state in front of me and now I have to deal with it. Maybe next time when she comes, or if required, that state might come up to me and then I will go into it. That's a different thing. But who is the patient right now in front of me, and my concern is only that, and I have to relieve her of her particular distress or disease. Clear? Okay, so what I will do is, now I will think, is this patient like belladonna? Is she scared? Is she violent? Is she on a pathological state of inflammation? Okay, so my thought process here is, am I seeing a case with acute inflammation of the symptoms, or am I seeing the symptoms have manifested suddenly and they are violent in nature? So any remedy that has violence and that has suddenness, I will delete it. Okay, now the next process going on, thought process going on in my mind is, so I see a lot of Baraitas over here. Okay, so is she like Baraita who's not capable of taking responsibility? Is she somebody who's very stupid or stunted? No. Mother says that she takes up her responsibilities. The time where the mother falls not okay, she will step up and she will do something for mother. Okay, so my possibility of Baraita is also gone. Okay, is she mistrustful or fearful like calcarea or lecasis or arsenic? No. Like causticum? No. So my this particular remedies are also gone. Is she comes up as a solid personality, as a strong personality who's ready to fight people like Nux vomica, plumbum, aurum? So no, and then it's gone. I have deducted the remedy. Now, which is the remedies that I can really put my focus on? So I have natrum mu, natrum carb, mac carb. Now, she can fall into this category. Are you getting? So she is a person who will not express her view. She is a person who loves, who cares for people, who's very conscious about her facial appearances. Okay, so mother says she's dark and there's a constant worry to her that she doesn't look good. So delusion go in mind. go in mind delusion. Wretched she looks. In mirror, yes, when. And you see, there is a remedy that stands very out. Take this. Okay, and you get in that, in all other remedies that you have, natramure stands out. And then the personality type. She is the one who will not express, only share, exchange her ideas, or communicate with her mother, very attached to her mother. Okay, and like I said, the whole appearance of the child, and it's a very simple case then of natramure for me. Then now I don't have to look left, right, and center. Now you see how I have deducted different remedies.
Dr. Sadaf, we have last 10 minutes remaining.
Okay, so I'm almost done. So with this deduction, so I hope the deduction of the other remedies is clear. So now for me, I know it's not even natrum carb or mac carb. Okay, it is natramure. And I gave her natramure 30 potency in plussing method. Okay, I gave it to her 30. Then after a month, 200, I went up to 1M in plussing method, very slowly and steadily. And I will show my, you can stop screen share so that I can show my slide. Okay, so we gave her natramure in plussing method followed by SL, and this is a picture after 2 months. All her white patches have gone. Her skin quality also has become better. Her allergies reduced. Her headaches, her sneezing, her itching has reduced. And overall, the child is doing good. Simple remedy. Further, she's only kept on SL. No other remedies after that. No remedies in between. Even in her acute, she responded well with natramure. So even in her acute, the remedies was not changed. Okay. So with this, my case presentation has come to an end. Now we can use the last 8 minutes for question and answer. Is it okay, Neha? Or you want to present something? I can't hear you.
With that, so there is one question by Dr. Swati. Is
Huh.
physical journals are to be taken for reporterization? Would you
Is
answer that?
physical general are to be taken for repertorization? Dr. Swati, like I said, it will all depend on case to case. There will be a case where I will not take physical generals at all. I may only take one or two mind. You have to see, I prefer personally the symptoms, whether they are of mind or whether they are of body, they should be something where there is no interpretation or physician's logic involved. Okay, in such cases who are stuck up at fact and emotion level, I would prefer taking physical general. Okay, but if it is a case where the patient has a lot of emotional symptoms and lot of drama going on in background, and she has done a lot of verbal diarrhea in front of me, I will pick up a very characteristic mental symptom in my repertorization. Okay, where I know this symptoms cannot be defied by anyone. Okay, so whether it is at a level of body or whether it is at a level of mind, pick up a symptom which is not interpreted. Like I remember in one of my sessions, or while interacting with a lot of homeopaths, one of the homeopaths told me that she was seeing a patient. No, we were just having a discussion, and few friends just walked in, and one of the friend was not talking, and one of the friend was very flamboyantly dressed and very talkative, very vivaciously she was speaking to all. And very quickly the homeopath next to me said, okay, this female has caution aversion, this female has libertinism, and she's to this, she's to that, and she described 2 3 remedies, and her patient was ready. So I felt that this is something where you're interpreting. Maybe you're right, I don't know, maybe that person might be right, but you have not spoken to the person. Okay, this is your interpretation that's coming to play, and then I will just not take that as a symptom in my maybe I may use it for analysis, because many methods have this way of interpretation in many cases, but those will not be a symptom which will anchor my case or on which I will base my foundation. Because some things, the reaction of what people say or what people do, could be a mask, could be something which they're just doing it. It's not the real they. So I may not take that symptom. I may just take a step back. I will wait. I will understand why a person is doing. Like very recently, I had a case where the person appeared to be very fearful, very scared, very dependent. But when I took the case, the whole idea that came up was this person was fearing that she will lose everything that she has, and she wanted everything in a proper order. So although this person looked like this, but deep down the person was something else. Okay, although a person looks very bold, deep down she's scared to death.
Yeah.
Okay, so the interpretation part is something that I avoid in my case. I take symptoms which are as it is, and that helps me in, and those cases where I have not interpreted, where I have just taken as it is symptoms, are the cases where I have succeeded. Then there are a lot of other approaches, a lot of other things. For 1 hour it is a very short time. You have miasms involved, you have different approaches like Boger approach, Bonninghausen approach, you have Borland approach, you have um, what was his name, uh, Clark approach. Okay, there are different ways which you can go through a case, but every case should need that particular approach. That's the whole idea.
So, Dr. Sadaf, we are short of time, so there are two questions. They both the questions are on pathology and doses. So
Okay.
one is about the doses and about the plussing method, how frequent one should dose. So can you please?
So plussing method for me goes case to case, depending upon how severe is the problem, how aggravating or how sensitive is the patient. I will choose the frequency. Plussing method in complaints like skin, asthmatic, cancers, I prefer taking, because a small dosage is given at a very frequent interval, and it's more diluted, and you do not exhaust potencies very easily, so it's a very safe method for you to use. So in this case, if you're case specific, if you're asking, plussing method frequency was once a day I had given. Okay, once a day for 7 days, then break, then once a day 7 days, then take a big break. As I continued with the uh, potency, repetition, or posology in this particular case. In other cases, it will all depend upon the nature of pathology, nature of the patient. Is the patient idiosyncratic, very sensitive, hypersensitive? I will decide according to that.
And in this case, yeah, in this case, what was your pathology like? How did you give the dosage? How many days the medicine then followed by placebo?
So, like I said, first I gave 30 plussing method for once a day for 7 days. Then I gave a break. If I saw the remedy reaction was there, I was not repeating the remedy. Once I thought that the remedy reaction has stopped, I'm not seeing the potential progress, I repeated 30. If I felt the 30 is completely exhausted, then I went to 200, then I went to 1M.
So these were the questions. So I'll just quickly check. Utkarsh, can you please let me know if there are any question on YouTube? So we'll take that question as well. I guess there's no question on YouTube for now. Uh, so, uh, Thank you, Dr. Sata, for being a part of this webinar, for having amazing insight of your knowledge on dermatological cases. Uh, this video will be uploaded on YouTube. If any of our viewers have any doubt, you can write your questions in comment box. Uh, we'll communicate with Dr. Sadaf and we'll give answers to you regarding your queries. So thanks a lot to
You
all
all
the
can email me also if you all want any queries. I'll just share my email ID in the box.
So you would be able to see Dr. Sadaf's email ID. So you can email your doubts to Dr. Sadaf as well. So thank you all the viewers for joining us for this session. Thank you, Dr. Sadaf, for joining us today. So I'll be concluding this session now if there are no questions. So have a great day ahead. Thank you.
Okay, bye bye.